To just give the public a little bit of understanding on what happens with the air quality section, that it's more than just the CEC's responsibility for this project, unlike some of the other issue areas. While we are doing our analysis, at the same time right now the district is doing its permit analysis for the project, and will be providing a preliminary determination of compliance that we will integrate into our conditions. We will have our own separate conditions of certification for air quality above and beyond those requirements from the district for both construction mitigation and operation mitigation. That PDOC will come in prior to our publication of the preliminary staff assessment and the final determination of compliance, which they usually get done about 30 days after, because they have a public notice period of 30 days, just the same as we do for the preliminary staff assessment. Will come in before we finish our final staff assessment. In my latest discussions with the district's permitting engineer, Arthur Carbonell, he plans to have his preliminary determination of compliance done by the end of this month. So he is going to be quite a bit ahead of us in terms of schedule, which isn't always the case. In terms of what I'm talking about, district, San Diego Air Pollution Control District.
Yes, you have a question.
Yeah, I'd like to know, when you do these research studies on air quality and stuff, they all is done like that. Many of us have lived less than 1,500 feet for 50 years or more in this neighborhood, and not once have we ever been asked about how our mental health has been, or how can they know how the air quality is going to affect people if they don't ask the people. In my block alone, 2 block radius, there has been 3 deaths of cancer in men under 50, a large amount of Alzheimer's patients. But nobody has asked us if the air has affected us with the existing power plant. So how are we going to know if it's expanded, if we're going to be asked even then? Nobody has asked the people, how is their health? How can you make a study if the people directly involved aren't even asked?
Well, I think the study is based on monitoring data throughout the county.
Nobody monitored us.
How come it was built here? Why there's other areas out there where there's nothing there? You know, there's nothing but kids, grandkids, old people, kids that have asthma. I mean, why there?
Yeah, and they're in our staff analysis. There's a couple sections we. Well, that's one of the sections in our analysis. You know, we look at environmental justice issues, socioeconomic. So that will be one full and independent section of the Energy Commission's analysis, which looks at the siting of the power plant in socioeconomic and in a racial makeup. So
let me try to add something to what Christopher has said. We do look at disease incident rates in a community where a power plant is proposed to be sited. So we are looking at it, but we've just started our assessment, so please give us an opportunity to do that. But you raise a valid point in that if a disease incident is not reported to a doctor or a hospital or a school, it may not be picked up in one of the databases that the California Department of Public Health has, or San Diego County has, or the city has. That is a generic problem in looking at incident rates. But we do our best to pick up just about everything we can, and we will look at those.
Another thing, what about the river bottom? They have spent all this money to clean up the river bottom and make it this environmental preserve and trail park. Isn't that counterproductive by expanding this power plant? Who's going to want to go to the trail park when you've got this thing over here?
yeah, and that's another thing that we look at in visual resources. We look at that in biological and in land use as far as compatibility. That's one. Well, actually, we're going to get to land use right after hazmat, and we'll talk a little bit about as you say, about compatibility of planned uses, other potential uses, and a power plant. Yes, and
Yeah, just a follow-up, question on the health analysis. I think you're correct in pointing out that the existing databases and registries aren't adequate to capture disease rates in a small area such as this neighborhood. And what I hear people saying is that you need to do an actual community health survey and find out what's out there in the neighborhood that's actually in the radius of the proposed plant.
I think that is something that we can consider, but I do not want to give you false hope. The Energy Commission staff does indeed rely on public health departments, both at the state, the county, and the local level. We cannot do everything, nor do we have the expertise in-house of epidemiologists. I'm a toxicologist, not an epidemiologist. So when, for example, looking at asthma rates, I can look at the state surveys, I can look at the UCLA study, which was self-reporting of asthma with questionnaires to households in every county. A lot of people think that's a very good study. But I want to say that we will make an effort, but it would be unprecedented for Energy Commission staff who lack the expertise to fill out a questionnaire and go door to door. So we don't have the expertise. I think this is something that we could work with the county health department and see what information they have.
That's our life,
Can
Why don't
we
you just set up
form a
a-
questionnaire and let you know what cancers we have in our family?
well,
Alzheimer's we have in our grandparents' life?
part of the Energy Commission's process, we try to make this the reason we're having this meeting and meetings like this is to try to make this as transparent as possible and to also give the public a chance to provide us information. As I said, any information you provide, preferably in writing so that I can distribute it, share it, get it as accurate as possible, that goes into the docket for this project. And so everyone, at this table gets that information, gets that concern. So yes, if you provide us information, that will go into the record, it will be looked at. It's just, as you can imagine, and as Alvin said, we don't have the expertise to look at every one of those issues, but we do our best to look at any information that's publicly available. Sir, Teresa had her hand up first, and then I will get to you, please.
Yes. Well, actually, in this neighborhood, a lot of people do not go to doctors in the United States. They go to doctors in Mexico. So this stuff is not reported to the Department of Health or any of the studies that you're using, but yet they have significant health effects. And that should be taken in consideration. You need to get somebody who can do this kind of epidemiological, study.
Thank you. Sir,